Well, peptide therapy really is somewhat of a new type of therapy where we can use compounds really that already exist in your body, small chain amino acids. And so I say new because there are many peptides that have been isolated that have specific actions in the last several years. But again, is not new because insulin's a peptide and it's been around for a very long time. So um, when people say, "Well, I want peptide therapy," it is a little difficult until we get into specifics of, all right, what's going on in your life? What are we trying to obtain? Is this for generalized inflammation? Do you have a problem with a specific joint? Is this to stimulate growth hormone production? So really, there are a number of different indications for peptide therapy that we deal with every week. So there are specific peptides that we use, let's say for inflammation. BPC 157 is a great peptide that some have used in joint injections. I've certainly used it in patients with ulcerative colitis, inflammatory bowel disease, some patients with inflammation, let's say in their lungs from emphysema or COPD. So there's many different applications depending on the source of someone's pain, things that help increase your own human growth hormone production. So oftentimes before we'll even consider giving someone human growth hormone, we want to try and stimulate your body to make more growth hormone. Well, how do we do that? Well, there's a couple different peptides. One, and they all have crazy names. One, CJC 1295 slash hypomorelin. That is very effective in either twice daily dosing. Sometimes we could tolerate a double dose at bedtime. Tesniborelin is one that we've used in the past a lot that had very strong and direct activity on helping to stimulate you to increase your own human growth hormone production. There's another called AOD 9064. And as I said, the names are kind of crazy, but that not only helps with weight loss, but also does stimulate human growth hormone production. So it really depends on understanding patients' goals and their needs. We can use specific peptides to help bolster immune function, cognitive, function can be affected as well. And so we really have to try and tailor it specifically for what your needs may be in order to determine if peptides is the way to go. Sometimes we have to just go straight to other methods, as in, direct hormone therapy. So there's a lot of questions that you may have, that I may have, and trying to determine what's the best course of action to help our patients. And so, as I said, we use specific peptides to help increase human growth hormone production. There really are no effective peptides to increase testosterone production. So really, depending on age, patient symptoms, what the blood levels look like, that indication for hormone therapy is really of and by itself something that we do to optimize human performance. So one, we want the foundational hormones to be at their peak or in optimal levels, and not superhuman levels or ridiculous amounts that could be unsafe, but in specific ranges, really where patients were in their 20s and sometimes 30s, and then slowly, although sometimes rapidly, hormone levels decline 1 to 3% a year. How peptides are administered really depends on the specific peptide that we're using. There are some that can be used in a nasal spray, like PT141, that significantly enhances sexual function. That can be effective. Sub-Q injections are more effective as far as the results that we see with that specific peptide, but also across the board, because of of absorption through the GI tract, we would expect not to have as good levels in the blood as we would from subcutaneous injection.